My name's Miranda Hann. I'm a GP in Tasmania, and I work with a large community of trans and gender diverse patients and support them with their general health and also gender journeys that they're on. And I do this work largely because I've done a lot of extra training in this area and have sort of more exposure than what we typically get through both med school and GP training. So when my trans and gender diverse young people come to see me, it's often around a variety of things. So people are complex, multifaceted humans. And so their trans identity is only a small part of the reason that they're seeing me as a health provider. And so a lot of what I'll be managing and supporting is their other medical conditions, whether that's things like asthma or celiac disease or anything else that they might be presenting with. And then I'm also going to be managing and supporting their gender journey and whatever that might look like for them. So some of my younger kids, I'll be referring to the Royal Hobart Hospital for work within their specialist service there. Other kids aren't interested in puberty blockers or hormone therapy, and so they don't need services like that. And so it's going to be more around supporting their gender journey from connecting with community, supporting parents and helping with parental understanding and knowledge, making sure that if they're having any trouble in school, that we're helping to support their school experience. And some of our organizations in Tasmania are really, really great with that, such as Working It Out, and making sure that their gender journey is sort of honored in whatever that might look like for them. My older teenagers, it's going to be more about management with me and a multidisciplinary team here, and that's just because they've sort of outgrown a lot of the capacity of what our pediatrics department has available, and that's going to be sort of a longer set of consultations with family and the patient to make sure that we're in a space that we're, again, honoring whatever their gender journey looks like and whether that's hormone therapy or not. Conversion practices are there to sort of fix what is seen as a deficit in people or something that's wrong, right? And so the way that conversion practices work is they go, your identity as a human being is, quote, wrong, and thus we must, quote, fix it in order to sort of align that person with the values of who is doing the conversion. And so in our trans and gender diverse patients, what this would look like is somebody who is seen as affirming their gender, that person would be seen as wrong for affirming their identity and who they are, and would be sort of forced to live in the sex assigned at birth rather than the gender that they identify with. And, you know, this only perpetuates a lot of the ongoing trauma that trans and gender diverse people experience from ongoing media representations that are really negative, community attitudes that can sometimes be really harmful and detrimental, and potentially in healthcare spaces when they don't experience affirming healthcare. And the more places where trans and gender diverse people experience that sort of negative attitude towards their identity, the higher the rates of PTSD, the higher the rates of depression, the higher rates of anxiety. And as a result, not exclusively of conversion practices, but of sort of a climate of poor attitudes towards trans and gender diverse people, there are higher rates of suicide in this community. And so in a recent study, it showed that 35% of people over the age of 18 had attempted suicide in their lifetime, which is just exorbitantly huge. The Writing Themselves in For study showed that in our transgender young people, they are 3 to 4 times more likely to have experienced PTSD or attempt suicide had they been exposed to conversion practices during their young people lifetime. And so these are really concerning statistics. We're at risk of losing a big portion of our community to suicide as a result of things like conversion practices, and losing a whole population of young people because of this would be devastating. And the more we can do to help create acceptance and understanding of a community that feels different for a lot of people, the better the survival of those young people as they sort of age and process through their lifespan. In Australia, it's actually legally required for both parents to consent to any medical intervention related to gender affirming therapy for trans and gender diverse young people. So that's anybody under 18, which means if we're accessing puberty blockers, hormone therapy, surgical procedures, which really surgical procedures aren't done in young people in Australia. But the hormone therapy and puberty blockers, they have to have both parents consenting to any form of intervention that's done. And additionally, all of those patients have to see a multidisciplinary team. So not only would the patient come to see me to have a discussion about their gender journey, I would then be referring them to our pediatrics department at the Royal Hobart Hospital, to our gender service there. They'd see a pediatrician. They often see a pediatric endocrinologist. They see a psychiatrist, and they often see a psychologist. And so that's a big team of people that you're involving in your medical care, and also means that that young person is going to be seeing multiple health professionals before any type of therapy is started whatsoever. So there's a lot of hoops for kids to jump through and families to jump through in order to affirm their gender. It's not an easy process, and it's often incredibly difficult and challenging for families to really be able to access appropriate medical care due to the amount of oversight that we actually have in medicine in the way that we approach gender affirming care for young people under 18. So as a result of this requirement of both parents being consenting to medical care for patients, it actually creates a lot of difficulty for our patients who are in one-parent households due to family violence or other concerns, or potentially have been kicked out of home due to their gender identity. And so my young people who are struggling with homelessness, I'm not able to access any gender affirming care for them. My young people who are in single parent households, for safety reasons, we aren't able to access gender affirming care. And so sometimes these barriers can actually be really, really challenging for community, because we are more likely to see some of the risks associated with gender affirmation in terms of a social perspective of minimal acceptance from family, contributing to reasons why we can't access care for patients. And those barriers just, again, increase those risks of depression and suicide in this population. And so while the checks and balances are in place for a reason, it also creates a lot of challenge for patients who aren't able to tick all those boxes that need to be ticked in order to access care. Far from being too easy to access care, it can actually be really difficult for patients to get the care that they need because of the high level of checks and balances that are in place as a result of what's called the Imogen decision, which was a federal court decision in 2020, which is what put all of these constraints in place around parental consent. Yeah, so the convergent practice legislation, as recommended by the Tasmanian Law Reform Institute, won't have any effect on the way that doctors are already practicing in the medical field. And that's because we already practice ethically in medicine, meaning that if you ethically object to something that a patient is presenting to you with, our ethical obligations as a doctor is to say, thank you for bringing that to me. Can I refer you onwards to another doctor who might have more experience in this field? So the most common sort of example of this that people would be familiar with is patients accessing medical terminations or abortions. So some doctors aren't going to be offering that for their own personal ethical reasons, which is absolutely reasonable. That doctor would then just need to refer that patient onwards to somebody who does offer medical terminations, so that patient isn't losing the ability to access care because of that doctor's ethical objections. And so that's how we operate in medicine. It's how every doctor operates whenever they are up against something that they're not familiar or comfortable with. And so this legislation isn't going to change those ethical boundaries. And we've seen in Victoria with their legislation that's gone through that they haven't had any issues with their medical community and being able to provide the same type of care as previous to patients.